the Delta variant is very contagious. It's going around right now, and certainly there are breakthrough cases. When you look at it, if you've been vaccinated and you do get the Delta variant, the chances that you stay out of the hospital, in the ICU, or die is 99.9%. Obviously, these percentages can change over time as the virus changes, but the big thing to know is that if you aren't vaccinated, you have a pretty good chance of ending up significantly ill and potentially hospitalized.
About 4% of children will experience prolonged symptoms or severe symptoms or be hospitalized. They can't get the vaccine yet. It's our turn to do what we can.
Pregnant women are at increased risk for getting COVID. They're at increased risk for getting it, for getting sick, increased risk for being admitted to the hospital, and unfortunately being intubated and dying. The recommendation we give people that women who are considering getting pregnant, trying to get pregnant, are pregnant and breastfeeding, we strongly recommend considering getting this vaccine.
It was studied in and out in patients of various populations with different comorbidities, including heart disease, obesity, even pregnant patients.
There is absolutely no data at all that that's true. There's never been a vaccine that we have more experience with than this vaccine. We know this vaccine does not increase miscarriage rate. We know this vaccine does not increase birth defects.
Hundreds of children in the United States have died of COVID, and the children can spread it to their friends, their family, and vulnerable community members.
Yes, we know that if you've been infected with COVID-19 virus and you've survived the illness, that indeed you have some innate immunity. However, the duration of that immunity is unclear at this time. What we do know is that patients who have had COVID-19 infection and then go on to receive vaccine have more robust response to our vaccines and even greater levels of immunity.
All of the professional societies agree that breastfeeding should not be disrupted for COVID vaccination and that healthy mamas are essential for healthy babies. We encourage getting the vaccine.
The thing to remember with the Delta variant is the new saying is younger, quicker, sicker. It's certainly very important to keep this in mind that it is now affecting all ages.
Right now, nationally, about 20% of COVID cases are children, the majority of which can't be vaccinated for COVID yet. We have to do our part to protect the kids.
At our hospital, we had a patient with COVID that had to be intubated, and at 22 weeks of her pregnancy, we did an emergency C-section in an attempt to save the mother's life. And the baby died, and 2 days later, the mother died. And we're at a point now where a story like that is totally unnecessary. We're incredibly lucky to have this vaccine. This vaccine is over 95% effective. That's amazing.
I couldn't wait to become vaccinated. With my first shot of Moderna vaccine, I felt the weight of the world lifting from my shoulders, that I was less afraid to take care of my elderly and immunocompromised patients. I was less afraid to bring COVID-19 home to my family.
I vaccinated my 12-year-old the very first day, about an hour after the CDC said that we could.
Feel free to reach out to any of the Starling providers. We'd be more than happy to discuss the COVID-19 vaccine, what makes you nervous about it, and what we can do to help answer your questions and make you feel at ease.
It's time to do your part and get your shot. This is your shot, and it's time. It's time to roll up your sleeve, do your part, get vaccinated.